Here's the latest on COVID in Michigan as we end the week. The state health department reporting 36 more deaths today. Our daily average is down 10 from this time last week. 3,400 cases were added. Again, our daily average is trending down. And encouraging signs for the positivity rate. We're back in single digits. It sits at 9.7% tonight. The state is also battling a new COVID variant. We learned today that the first case of the India variant was found in Clinton County. In all, the state has nearly 2,300 confirmed variant cases.
India is dealing with a surge in COVID cases and variants, and because of that, the U.S. is now restricting travel there. The restrictions go into effect on Tuesday. The new travel order restrictions, they affect non-U.S. citizens who have recently been in India from entering the country. India has seen a 25% spike in cases over the last week. They now have some 19 million cases, second only to the U.S.
In Michigan, the race to get people vaccinated now has new purpose. Yesterday, Governor Whitmer setting benchmarks for when the state will reopen, all based on vaccinations.
Right now, 50% of eligible adults have had at least one shot. The first benchmark is 55%, and that would allow employees to return to work in their office buildings.
Once we hit that 70% mark, we can return to life as we knew it. But over the last few weeks, the number of people getting shots has started to decline.
News 8's Whitney Burney spoke with doctors about how realistic that 70% goal is and shows us how soon we might be able to meet it.
Since rolling out the COVID-19 vaccine, more than 4 million Michiganders have gotten at least their first dose of the vaccine. Another 1.5 million need to get that first dose before the governor says we reach that 70% benchmark and can take these off in public settings. But local health departments and healthcare workers say they're having to get more creative to convince people. Across the U.S., the number of people eager to get a COVID-19 shot is slowing. Take a look at the numbers in some of our local counties. This chart shows the number of people is going up, but in the last few weeks, it's been in smaller numbers. When you put this same data into a graph form, you can see the line becoming flatter over time, which means the rate Michiganders are getting their shots is slowing down. If we continue at our current rate of vaccinations, we could meet the 70% goal in June, but that would mean the number of people getting shots must remain steady.
We have, kind of reached that point where those who are really urgent about getting the vaccine, the older adults, people with underlying health conditions, most of those people have had opportunity to get vaccinated and have got vaccinated.
The Ottawa County Health Department says rural communities have been one of the populations that need extra convincing.
And the hesitancy sometimes isn't necessarily hesitancy. It might be a little bit of complacency, where if it's easy and it comes to me, that's great, I'll get it. But and that's the group that we want to get to right now.
In hopes of making things more convenient, the county is bringing vaccine clinics to events like Tulip Time this weekend. Vaccine sites are also offering walk-up clinics.
We have seen a shift. Certainly a few months ago, supply was the constraining resource, and now supply is actually quite abundant. We're now finding people that are willing to get vaccine as the constrained resource.
Dr. Josh Koistra with Spectrum Health says as vaccinations begin to trail, the governor's 70% goal feels quite a ways away.
If we can be effective with physicians having conversations with their patients, trying to really promote the vaccine safety and effectiveness, we may get there, but I have some reservations about getting to 70%.
Coming up tonight at 6, we're talking a little bit more about how vaccine hesitancy has played a role in those numbers trailing off. Reporting here in Grand Rapids, Whitney Burney, News 8.